Welcome, everyone. You are at Empowering Advocacy, Federal, State, and Patient Insights. It was wonderful to hear from Annie Kennedy about the action that you can take if you haven't already taken action on the pediatric review voucher. I hope you'll join us as soon as possible. We are going to hear about more actions you can take from Stephanie Riordan and Shannon von Felden. They're going to join me up here, and we'll hear more about EveryLife Foundation's advocacy efforts on all of our behalfs.
Great. Thank you so much, Pam. And thank you for everyone for being here today. Annie gave us a great lead-in to this session. So if you are interested in learning more about how you can be an advocate and join other rare disease patients, caregivers, and others in the community in advocating, then you're in the right place. We're going to be joined during this session by Stephanie Riordan, our Director of Patient Programs. I'm Shannon von Felden. I'm the Vice President of Advocacy at the EveryLife Foundation, and we have three amazing advocates here with us today who are going to share more about their experiences as rare disease advocates. If you haven't heard of the EveryLife Foundation for Rare Diseases, we are a nonprofit, nonpartisan organization dedicated to empowering the community to drive advocacy for impactful science-driven legislation, including advancing the equitable development of and access to life-saving diagnoses, treatments, and cures. And we do this through legislative advocacy. Our program, Rare Disease Legislative Advocates, is really dedicated to emboldening our patients, our caregivers, and community members to use their voice as advocates in legislative advocacy. So legislative advocacy is any activity by a person or a group who want to influence those who are making the important decisions and are making the laws that impact all of our lives. And advocacy is at the local, the state, and the federal levels. EveryLife and Rare Disease Legislative Advocates work with advocates across the country on local, state, and federal advocacy because where you live matters. Where you live is determining your ability to receive an accurate and timely diagnosis and your ability to access care and access medications that you need to continue to have quality of life. So advocacy at all of these levels is important. And your patient voice does matter. It is so important to this process. And we talk a lot about sharing your story and the power that sharing your story can have in legislative advocacy. Your policymakers, those who are making decisions at your state and federal levels, don't know what it is like to live with a rare disease unless they themselves have that same experience. So sharing your voice, sharing your story, and sharing what your day-to-day lives are, where those gaps in the healthcare system are, and what the challenges and barriers to continue to be able to treat and get your diagnoses and your medications and continue to get the care that you need is so vital to the system. And your patient voice adds that perspective. It adds and points out where those gaps exist and where those challenges and barriers are that they might not otherwise know about. And there are significant gaps in our system. We outline how rare diseases really is a public health emergency in the United States, and these numbers just give a real tangible evidence to what you already know in your daily lives, that it takes 15 years for a drug to be developed and approved by the FDA. There are 30 million people affected by rare diseases. The cost of having a rare disease is astronomical for the healthcare system and for the individuals and families, costing almost $1 trillion in 1 year in 2019. And most of those costs are being directly incurred by the families and society. And those are all important reasons why we advocate for the rare disease community and the importance of making sure that your voices are heard. And we have lots of different events and opportunities for you to engage and become an advocate if you aren't already. And we're gonna share about what those different opportunities are. So the first opportunity that is coming up in February of 2025 is Rare Disease Week on Capitol Hill. Hundreds of advocates gather in Washington, D.C. for this week. It's February 24th to 26th, and we have a series of events, a legislative conference, a Rare Reels documentary event, a Rare Disease Congressional Caucus briefing, a rare artist reception, and we schedule meetings for you to go and meet with your legislators in person in their offices in Washington, D.C. on Capitol Hill. If that sounds like something that you would be interested in participating in, we provide a limited number of travel reimbursements for advocates to attend and help cover some of those costs that are incurred by traveling to Washington, D.C. And the application is open now, and it is on our website. It closes on November 8th. And the travel reimbursements vary between $800 to $1,400, depending on the state that you're traveling from. Another great opportunity, especially if traveling to Washington, D.C. isn't possible for you and your family, we offer an opportunity in August called Rare Across America, and that's where we schedule virtual and in-person in-district meetings with your legislators. So this is a hybrid event where we schedule virtual meetings with your senators during the month of August when they're home for the August recess, and then in-person meetings for you to meet with your representative in their district office. The district offices for your representatives tend to be a lot closer to where you live, so it's a lot easier to be able to visit them in their district offices, and gives you an opportunity to do both virtual and in-person meetings, or one or the other. If you're not up for in-person meetings, you can just attend the virtual meetings with your senators. And that happens in August, and usually registration for that program opens in May. And then lastly for me, before I hand it over to my colleague Stephanie, is we are hosting a state advocacy day in Harrisburg, Pennsylvania next week. We will be in Harrisburg on Tuesday, and we have dozens of advocates registered to come to Harrisburg, learn about how state legislation is impacting them and how they can help create change at the state level. And they'll be meeting with their state legislators on Tuesday. So if you are from Pennsylvania or you know anyone from Pennsylvania, it's not too late to register. If you're interested, all you have to do is email Kendley at kjones@everylifefoundation.org. But that's a really great introduction to advocacy, and generally traveling to your state capital is a lot closer than traveling to Washington, D.C., and we hope to have more of these opportunities in other states in the coming year. So keep an eye out if that is something that you're interested in. And I'm going to hand it over to Stephanie.
Thank you, Shannon. As Shannon mentioned, my name is Stephanie Riordan. I am the Director of Patient Programs with the EveryLife Foundation for Rare Diseases. We recognize that our advocates come from a variety of backgrounds, as Shannon just mentioned, with the Pennsylvania State Advocacy Day being a great introduction to the rare space. We also recognize that there are people new to the rare advocacy world that may not have experience, and we want to make sure that we're providing different resources and opportunities for them. And so one of our programs that we have is our virtual Youth and Teen Advocacy Day that is held in the summer. It will be held in June 2025, and this is open for any advocates between the ages of 10 to 18. It is broken down, it's all virtual to give our youth and teen really an insight on how the government works, how laws are passed, how your voice really matters, how your story really matters. And at the end of our trainings, our advocates actually get to meet virtually with their members of Congress and share their stories. We have been so impressed with the youth and teen really advocating for policy changes. Annie spoke earlier about moving the needle. One of the resources that we created is a social story. You can see a snippet of it on the screen. It's called When I Meet with My Legislator, and this was a request from a mom whose child participated in our Youth and Teen Advocacy Day, but needed a little extra resources, so we always want to make sure that we are accessible and accommodating to the public. But for any rare disease organizations, if you have a Capitol Hill Day, I definitely recommend scanning this QR code that you see on the screen to be able to share that tool. It's even a great tool for adults to understand how you meet with your legislators. Another program that we have is specifically for our young adults. It is YAR, which stands for Young Adult Rare Representatives. And this is for advocates between the ages of 16 and 30 who are really, really passionate about the rare disease community, advocating for themselves and sharing their stories. We have many YARs in the room right now. You'll hear from one in a few minutes as well. But our YAR members range anywhere from patient advocates to family members to loved ones. It creates opportunities for skill building for the next generation of rare disease advocates. Our goal is to have at least one YAR in every state. So shameless plug, we do need a YAR member from Kansas. So if you are from Kansas or know anybody in Kansas who would like to be a YAR member, come see me. We would love to have you. YAR has a lot of opportunities for you to share your story and get engaged. One of the really key fun opportunities with YAR is the YAR policy campaign. So this looks at what is prevalent in the rare disease community for our young adults. So every year they get together and talk about what's happening in the rare disease space. So the priority for this year is ensuring access to approved treatments. So that includes the Safe Step Act and Accelerating Kids Access to Care Act. So they meet monthly to be able to talk about what's happening with these policies and really how you can use your voice and use your story to move that needle on those acts. We also have a Speakers Bureau, which is a phenomenal activity. It's training opportunities and roundtable practice for our young adults to be able to participate in sharing their story. And we lead to speaking opportunities across the country. As you'll see today, we have a YAR member. You'll see on the screen right now, that is a picture of Chandra, who was one of our YAR members who spoke at Ultragenyx Rare Family Day. We always try to find different opportunities for them to, again, elevate their voice and share their story. Our YAR Leadership Academy application is actually opening in October. The YAR Leadership Academy is a series of online classes about different opportunities and roles for patient representation in policy making and drug development and the regulatory process. So that application will open in October. It is a series of classes that will start in January. So any young adults, again, between 16 and 30 who are interested in really elevating their experience in the rare disease community and advocacy space, definitely would recommend applying for that Leadership Academy. If you are interested in joining YAR, there's a QR code on your screen for you to scan. You can also email our YAR program manager, Laura Romano, at lromano@everylifefoundation.org. Lastly, our Rare Artists program is an opportunity to share your story and advocate through art. The pictures that you see on the screen are our 2023 Rare Artist awardees, and I will say these come from a variety of backgrounds. I know some of you right now may be saying, I'm not an artist. Most of our artists will actually say the same thing, that they were not an artist when they entered Rare Artist, and they really wanted to be able to put a pen on paper, paintbrush on a canvas, and say, how can I share my story? How can I get the message out to the community of what it's like having a rare disease? So our Rare Artist program is in our 14th year right now. We actually just closed submissions this couple weeks ago. We have over, I want to say 230 entries, and they are all phenomenal. And we're really excited for the finalists to be revealed. So basically what's happening right now is our judges are reviewing all our Rare Artist submissions that we have, all 230 of them, and they will identify 20 finalists. The 20 finalists will work with our EveryLife staff to do an artist to advocate coaching to tell their story, to make sure they're understanding how can I use my artwork to meet with my legislators. You'll see a picture on your screen right now is Jessica during our Rare Disease Week. Rather than going into your meetings with your story to speak, they actually go in with a picture of their piece, whether that's on a postcard. Some people will make t-shirts to be able to have a memorable visual piece to tell their story and to advocate. I definitely recommend you all keep an eye out. Our finalists will be announced on October 15th. Sign up for our newsletter, follow Rare Artist on social media. Public voting will open on November 11th at rareartist.org or on the EveryLife website. So this will allow the public to identify the 20 that the judges chose and narrow it down to the 10 awardees. They are very powerful pieces. A lot of people resonate with them. The artists love connecting with the community. And if you are able to attend Rare Disease Week, as Shannon mentioned, you'll get a chance to meet the artists as we have a Rare Artist reception where they tell their story, they sign out little postcards for you to collect and meet all the artists. With that, I am very excited to introduce you to our panel. We have James Griffin, who is a member of our RDLA Advisory Committee. Paloma Juarez, who is also a member of the RDLA Advisory Committee, and Anneliese Williams, who is a YAR member, a Rare Artist finalist, a Rare Scholarship recipient, a wonderful group. Shannon will be moderating this panel.
Great. All right. Well, I'm really excited for this part, and we're going to try and leave some time at the end to also take questions from you all as well. But I'm excited to have James, Paloma, and Anneliese up here to talk more about their advocacy, what inspires them, and their experience being rare disease advocates. I'd love to just start out having James, Paloma, and Anneliese introduce themselves to you all and a little bit about their involvement in the rare disease advocacy community.
I'm James Griffin. Thank you for the introduction, Shannon, and I'm glad to be here. So thank you, Global Genes, for having me here. I got involved with EveryLife Foundation in 2019. I started advocating on Capitol Hill in their federal advocacy program. I am a rare patient and was diagnosed with sickle cell at the age of 2. I'm the only one in my family to be born with sickle cell, and I was in and out of the hospital as a child and an adult, and that led me to want to share my story and advocate. As an adult, I faced stigma with not being treated or being considered a drug seeker, and that led me to find new ways to advocate. And so I got involved with EveryLife Foundation and their federal advocacy program for Rare Disease Week, and I felt it was empowering for me to share my story and be able to help someone else. So that's how I got involved, and I'm also a member of their federal, I'm also a member of their RDLA Advisory Committee, which stands for Rare Disease Legislative Advocates.
Paloma?
Hello, my name is Paloma Juarez. Welcome to Kansas City. This is where I've been born and raised and where I'm raising 3 wonderful young men. We have a son, Vaughn, he's 8 years old, and then twins, Cohen and Xavier, who are 4. And yes, twin life is everything that you imagined and times 10. Add into that Vaughn and Cohen each have a diagnosis of infantile onset Pompe disease, and you can imagine we keep ourselves and a very adventurous and busy schedule here generally. We were fortunate enough that Vaughn was born on the Missouri side of Kansas City, and in 2016, Missouri was one of 5 states that had Pompe on their newborn screening panel. We had no idea in the beginning how much that one detail, that one privilege was going to lead to endless opportunities for our son. And within a year, we started meeting other people within our community and realized that that detail made his journey much more miraculous. And so my husband and I set out to make it our mission, our business, our priority, that every single kiddo was going to have those opportunities, that Vaughn was not going to be special because of how quickly he was diagnosed, but he was going to be special on his own terms because of who he was. So that led us to beginning to advocate in Kansas at our state legislature to add Pompe for newborn screening. Along the road, I have met so many amazing people that have helped support this idea. Our community is incredibly involved in making sure that Pompe was added. And once Texas actually starts their program process, we will now hear, my son is 8, so 8 years later, we went from 5 states to 98% of the country, newborn children will be screened for Pompe. So that just felt amazing. In 2020, during the pandemic, I saw something come across my newsfeed to do Rare Disease Week on Capitol Hill virtually, and that really changed the course of understanding that our experience doesn't just matter for Pompe, for my boys, for our children, but really for rare disease folks in general. And that goes for not just the patient themselves, but families, teachers, friends, other advocates, all the people that are involved in that journey with you. So I've been privileged to just continue to use every opportunity and seize every opportunity that EveryLife has to speak about our story and the importance of courage and community. So yeah, thank you. I'm so excited to be here.
Hi, I'm Anneliese, and I am really honored to be here and privileged to get to speak to you today. I'm a patient advocate and also a Master's of Public Health student at Purdue University and a global pediatric oncology researcher at St. Jude Children's Hospital. My advocacy journey began in 2022 when I was diagnosed with Guillain-Barré syndrome, which is a rare autoimmune condition in which your body attacks your nerves, causing ascending paralysis. So basically, overnight, I went from an active college student and soccer player to a quadriplegic in the ICU, requiring breathing support and medications just to keep me alive. And while my disease is lucky enough to have some treatments that can slow its progression in the acute phase, there's nothing curative. And I distinctly remember an early day in the ICU when my doctor pulled up a chair next to me, looked me in the eyes, and said, "We are doing our absolute best to keep you alive, but for the next 4 days, there's not much more we can do than hope." And while I survived and discharged about 2.5 months later, my experiences, paralyzed from the neck down and largely unable to communicate because of the breathing apparatuses, really lit a fire in me and made me angry. And with that angry, I turned to WIR and became a WIR member. And I realized there's a whole community of people and other young adults and other patients and families who might not share my diagnosis, but they share my experiences. And that was really powerful. I became a Rare Artist finalist, a Rare Scholarship recipient, which helped me continue my education, and began talking on Capitol Hill during Rare Disease Week and Rare Across America. I then joined the WIR Leadership Academy, which Stephanie mentioned earlier, and learned about rare disease advisory councils. And alongside my twin sister, we spearheaded an effort in Indiana to pass legislation to create one, because Indiana previously didn't have one. So we brought stakeholders from across the state who are impacted or interact with rare disease in various ways together to form a coalition. And then we brought that to the State House. We advised on the wording of legislation in HB 1201. And then my sister and I testified in the Indiana House and Senate Health Committees in support of that passage, which I'm proud to say passed in the spring of 2023, and we now have an active Rare Disease Advisory Council in the state of Indiana. So I'm really happy to be here today and hope to inspire you to take the next step in your advocacy journey, whatever that might look like for you.
Amazing. Amazing. Well, you all have outlined kind of how you started and all that you've accomplished since you started in a relatively impressively short amount of time. So I'd love for you all to share with the audience what your biggest a piece of advice for someone who's just starting out in legislative advocacy, and what your advice to them would be?
My biggest piece of advice is to start now and start where you're at. Your journey is not going to look like someone else's, but just remember that you have an opportunity to make an impact for yourself and for others in your rare community, or going through what you're going through, or just like Anneliese said, someone else who may be dealing with a health issue and don't know where to turn. Your voice has power. Your voice can make an impact. And by sharing your story, you get to make a change for not only yourself, but for other people. And that's very important. That was important for me. I wanted to be the change I wanted to see. So I started speaking up because I knew I wasn't the only one facing disparities, health disparities, or facing stigmas, or having to wait a long time in ERs, or not being given an adequate amount of medication. So that was very hurtful to me at the time. I was going through it. I was frustrated, and I didn't know what to do. And so just thinking back about myself and being in that position again, I always wished there was somebody who could speak up for sickle cell, or who could share their story for me and raise awareness. So I took it upon myself to be able to use my voice and say, you know what, I want to be the change. I want to speak up, and I want to make sure that no one else has to face what I went through. No one else has to wait in a hospital for hours just to get seen. And I wanted to make sure that no one else's family has to face the economic burdens that my family faced by having me born with a rare disease and not having the medical help or the laws or insurances put in. So I wanted to change that, and I wanted to advocate. And I never wanted to get into politics, or because I thought it was a bit too much. I never thought about advocating in this form, but I came across EveryLife, and I thought it was more than politics. And what I was doing was helping people, and I was helping people get health care. So it's important for me to advocate, and it's important for you to use your voice to advocate, and whatever rare disease you face, or if you're not a patient living with a rare disease, if you're a family member or if you're a parent, it's important that you share your story. I've sat on Capitol Hill with parents who shared their story for their kids, and it was very impactful, and you can have that same impact.
I mean, I look out here and I'm like, I was that person at the beginning of this journey that was like, you people are crazy courageous. I would not sit up there and do what you're doing right now. And over the years, I have learned, I'm a huge Brené Brown fan, and she talks a lot about, in one of her books, The Gifts of Imperfection, about what courage is, and how the word core actually means to speak one's mind by telling one's heart, right? And that resonated with me. And I think that very much, oftentimes, we are very comfortable spearheading and arguing. I mean, raise your hand if you've cussed out a doctor before. I've done it. Like, it happens, right? This is what you do. That voice, that courage that it takes to advocate for yourself personally like that is no different than what we do right here. So oftentimes people will be like, oh, my story feels insignificant, or how can it make a change, or I'm just not as courageous as you. But you are, because you do it every single day. Brené Brown, again, she talks about courage is like a habit, a virtue. You get courageous the same way that you learn to swim. You learn to swim by swimming. So every single day, every moment that you've yelled at a doctor, every moment that you took an extra step, right, you are learning courage by couraging. And so you have it within you. There are people begging and wanting. I can't tell you how often we get into a legislator's office or talk to a staffer. They'll hear something like 60% of $1 trillion is your guys' issue. Yes, let me tell you more about that. What does this actually look like? So that they don't just see a number. The number grabs their attention, right? But your story and your personal connection to that really makes it attainable and something that needs to be fixed. So do it. Just courage by couraging.
I would echo a lot of what my fellow panelists said, but I think the most important thing to me is to always stay connected and remember my why. And so it's easy as a young person to go into a government office and feel like I cannot possibly make a difference with my story. There's a sense of imposter syndrome. There are people who paid to advocate. There are these advocates with these impressive resumes, and I'm like, how could I possibly measure up? But then before every single meeting, what I'll do is I'll take a moment by myself and I'll think back to who I was at 21, in a ton of pain in an ICU room, and all I wanted to do was tell my nurse, I need help, I need pain medicine, and she would walk in and walk out, and I could not advocate for myself because I physically had no way to do it. I think back to that person, and I would love to go give her a hug. I'd love to go change it for that person, and I cannot. But then I ask myself, what if that was my baby sister? Because she hasn't experienced that, but she very well could. And if I ask myself, what if I don't make a difference? I reframe that and say, what if I do make a difference? And that's all that I need to overcome that anxiety and the what ifs. It doesn't matter, because what if it does?
Yeah, paid lobbyists can't do what you do, right? They can't put that face, they can't put that personal experience. All they have is a nice suit and fancy words, and they know how the system works. So this is exactly what your legislators need to hear is from you. I'd love to hear from Anneliese, especially as a participant of the Rare Artists Program. What advice you have for sharing your story through other medium, and how you make that tie of your personal story to legislation?
I think especially in my early days of advocacy, I was really overwhelmed by this idea of like, I had months of these experiences and these traumas and this interaction with this rare disease space that were hard. And it's hard to feel like I can adequately capture that in 5 minutes and connect that to an ask and make them remember it. So what I've reframed to do, and art is really helpful for this, is to pick one impactful moment and try to really paint that vividly, either through words or through art, to make the senator or representative remember that. So when I walk in, when I walk into my representative's office to this day, they don't know my name. They don't remember my diagnosis, but they can tell me, you're the girl who was paralyzed overnight and had no treatment options. And to me, that's a win as an advocate. And I think art is a really powerful way to capture that moment. I can put so much more emotion in a piece of art than I can in 100 words, 200 words, or a 5-minute conversation, because you bring the senator or the representative in with you. And not only that, because you can give them the piece of art, they can take that, if it's a staffer, they can take that to the senator or the representative. So it's a really powerful tool to make that 5-minute conversation last a whole year or 2 years or however long that piece of art lasts.
Yeah, and it's all about, whether it's through art or sharing your story, it's all about building that relationship so that, you know, it's not this one-time communication, but it's continual. Paloma, you talked about starting your advocacy federally during the pandemic, back when things were all virtual. Could you speak a little bit about maybe the experience that you had and some of the benefits you found in virtual versus in-person opportunities?
So I just assumed that being in the comfort of my dining room with my computer and my favorite coffee mug, that this would be less intimidating. And that was not the case. I got into my first Zoom call, and it was just me and a staffer. None of the other people had shown up, and I was intimidated. And I was like, I have to talk to this person by myself for 15 minutes? What are we going to talk about? So I remember vividly emailing somebody from your staff, like, is anybody going to come on this call? What am I supposed to do? And Caitlin actually told me, she was like, you got this. She's like, you're a talker, just talk, just be you. And by my 4th meeting that day, I watched myself get so much better, so much stronger. I learned courage by couraging. And my last meeting, actually, I was privileged to have Annie Kennedy join me for a hot second. And I was like, ooh. But I felt really confident by that point. And by that point, I was really just speaking to the things that we talked about. There isn't fancy language here. There isn't some way that I'm supposed to do this. I'm just supposed to be authentic and be able to say how one detail in my story could impact not just what our family went through, but impact so many others, and that 1 minute to tie it all together. And I actually got that senator that day that said, you know what, let's talk a little more. Send me more about why reauthorizing Newborn Screening Act would be important. And I felt tremendous pride. I was like, I did it, right? And that, I think that's the cool part. There feels virtually sometimes, and that's why I love the Rare Across America program. I love that we have both opportunities to actually physically be there, because I do think there's something about connection in that way. But then the opportunity to continue to be involved from the comfort of your home with your favorite coffee mug, doing those things, right? There's a piece or an opportunity for all of you, however it makes sense or is more comfortable for you, or you can, dive headfirst like all of us and do all of it. So, it's, the opportunities are there for you, and there's definitely benefits to each and every one of them.
Definitely. I'd love, before we take questions from the audience, I'd love to hear from each of you what the biggest lesson you've learned through your rare disease advocacy journey has been.
I'll just say that you can't let the no stop you. You have to keep going. Biggest lesson I learned is to continue to practice your pitch, for one. Learn your story, be able to tell your story concisely, so that when you have that opportunity in front of those members of Congress, you can get your point across and they can hear you. You don't have much time unfortunately, with the staffers or the members of Congress, but you do have enough time to make your point and share your story. And you have to be able to practice your story so that when you get in that office, you're able to let them know how you feel, what you're saying, and what bills you're trying to get passed. And like I said, to start, you can't be discouraged by the no's. It takes time. That's what I learned. It takes time to pass a bill, but it's a journey, and you have to continue to do it because you're the hope for someone else. And to see that bill pass is going to be helpful for you, for your family, for the next family, and the community. So you have to know your vitamin and keep going, and just don't give up, because it's a lot of people wishing and hoping for change, and you can be that beacon of hope for them, for others, and you can make a difference by sharing your story and not giving up and not quitting. Because at the end of the day, once that bill gets passed, you will see the difference, and you will know how it felt to have that bill passed, because you'll be able to create memories, more moments with your family, and have more time. And that's the one thing, as a rare patient, we're advocating for time, because we don't know how much time we have if the bill doesn't get passed. So we want to make sure that we're persistent. I know many of us have sat on calls with insurance companies just to get the medical equipment we need, and we didn't give up. We've been taken in a circle, but we continue to stay on the phone with the insurance companies until we got that medical equipment, or we got that the insurance that we needed, so that we could get the treatment. And that's what you have to do in legislation. You have to keep going and keep fighting and don't give up. So that's what I would say.
I think there's two big lessons that I've learned doing this. The first one is we very much so often are so used to being the expert within our own disease or our loved one's disease that we take on this vocabulary and role of an expert. You very much, though, what you're looking to do is not necessarily be the expert in these opportunities. You are looking to just be authentic. And so that is the hard one, getting people to understand that this is not the time that I have to be the expert in my disease. I have to be the expert in my loved one or myself's experience. And so reframing that idea, I think, has been one major lesson learned. I think the other lesson that James spoke to a little bit is this is not a one meeting and done. Your one meeting is your introduction. You have to be ready to be persistent and consistent with your message. So that means that, like she said, this is the opportunity for them to have something tangible to recognize you with, but follow up with the email. There was a staffer that every month I sent her a picture of the kids. And she's unfortunately in another office, but we were able to accomplish and build a relationship and get a lot of support out of that legislator because I was very persistent and I was very consistent in, you will know my children. And she did. And I think there's a respect factor to that. So don't look at these moments as I'm going in and they are going to say, yes, I'm going to sign the bill. This is your opportunity to introduce yourself, let them get to know a snippet of you, and then open the door to more communication, because it's that communication and connection that's going to take us towards that finish line.
I also have two things. One that echoes something Paloma said, which is you don't need to be a policy expert. You don't need to be an expert on the government. What you need to be is a determined storyteller. So if you can tell your story and tell it in a way that has a lasting impact and do that without giving up, I think that's the way to really harness your power as a patient or a family member or a caregiver or a friend of someone with rare disease. And the other thing is that there's a lot of moments I've found in advocacy that feel like they're failures. Like, I just wasted a lot of time and accomplished absolutely nothing. I think of early in my sister and I's journey with establishing the Rare Disease Advisory Council. This representative sponsored a bill that was relevant, and we were going to use that bill and modify it to make it into the Rare Disease Advisory Council that best met the needs of our patients in our state. And so we make an appointment with this representative. We drive like an hour and a half to get there. Wait, it's not accessible at all. So we end up meeting in this back corner with like tons of people passing by. She comes in and she's like, I don't even know what this bill's about. I just wrote my name on it. And we're like, well, that feels like a dead end. And we were like, this seems like a failure. But we got to talking and she's like, the only thing I have is I know someone who knows a lobbyist who might know something about the bill, and I have that person's phone number. And that phone number turned into everything because we got connected with that lobbyist. And after that meeting, we were like, this is a dead end. This legislative session is not going to be the one that our bill gets through because the sponsor doesn't know, we have no connections, and like we're running out of time. But I think being able to step back now and say, that was actually the most successful meeting it possibly could be, has given me a new perspective on advocacy that in the moment, you're not going to know how successful you are. So you just have to keep going and keep that determination going, even when you feel like you're failing again and again and again.
Well, I think that's a good point for us to take a moment. Thank you to James, Paloma, and Anneliese. We would love to take some questions from the audience. I think maybe we have one over there.
Actually, I have a question from our virtual audience. Woohoo! I know. How do you get family and friends involved with rare advocacy so they can participate rather than just watch from the sidelines?
Great question.
Well, if they're anything like my friends, alcohol helps, or the promise of alcohol. No, I mean, again, I think it's just about telling them that when we are asking for certain legislative asks, obviously we're asking for things for our specific rare disease community, right? But understanding that when we take care of our most vulnerable populations, how that is impacting the overall community. So one of the things that we really worked on this year was Safe Step Act. And that was something that we talked about. You know, my mom's in the audience today, and we used her diabetes medication as a very good example that while this is something very important to rare disease patients, this is important to all kinds of patients, right? And so I think sometimes letting your friends and family know, listen, like you don't need to come in and be the expert of rare or the disease itself. I need you to be an expert to what has our experience, what does that look like from the sidelines? Because they're all gonna have their own emotions about that too. But also, would it help your mom? Would it help your grandmother? Does it help your partner, right? Because all of those things trickle and filter in. So I think encouraging them that it's not just about supporting you and your endeavors, you're supporting a greater cause and community there. And alcohol, again, always helps. Make sure they're of age though, yeah.
I agree with that. The one thing I would add is, and this is applicable to friends and family, but also yourself, which is you can go to meetings And your first time, just watch or just introduce yourself and who you are without making the ask. So in Indiana this past year, we had another young adult who came with us, and she watched, she introduced who she was in her relation to rare disease, and got to witness what advocacy looked like. And that starts to break down that barrier of anxiety of, I'm going in here and doing something I have no idea what it is, and take some of that pressure off. And then once they see how powerful those moments are, I think it starts to get some traction of, this is something I could actually do myself.
Yeah, and there can be those small steps to encourage your family and friends to take for you, that they can write emails and they can make phone calls and they can make those kind of small baby steps towards advocacy that maybe are a little bit easier too, that aren't meetings, and they can kind of make those steps in that direction. Do we have any other questions?
Have one back here.
Great.
I worked with EveryLife Foundation to get Pompe disease and MPS1 added to newborn screening panel. And I really appreciate something that was expressed on the panel, which is we have to redefine what winning looks like or what losing looks like, because the very first year it was a failure. We were sent by EveryLife to the Department of Human and Health Services in Jacksonville. When they had scheduled for patient advocates to speak, it was after the vote, which I thought was the most ridiculous thing. So I interrupted the meeting, almost cursed everybody out, but I didn't. But just said, listen, if you're serious about listening to patient voices, maybe you should consider letting us speak before you vote, because that's just insane. So that year we weren't successful, and then EveryLife sent a gang of parents, and the next year we were successful. And so I really appreciate what was said, which is, let no kind of be your medicine or your vitamin, so to speak, because it's, you have to be fueled by what are supposed losses, and understand that those are the small steps that are taken in order to get to those wins. I really appreciate that.
Thank you.
Thank you.
Yeah, the first time that we went to Topeka for the Kansas State Legislature, we had, our 2-year-old at the time with us, and we're in this beautiful grand hall and telling our story, and, got people crying with us. So I felt like, yes, we made that connection. And instantly when I was done speaking, it was, well, we just don't really have 2 million to throw at that, so we're just gonna vote no. And it literally happened that fast. And I left disappointed, and I was like, I missed the opportunity. And so when we went back, I really tried to reframe and think about the idea of, well, what language do I need to speak? What are their priorities that make it hard for them to do something? And so to your point, and to Anneliese's point, sometimes those failures really aren't failures. They're really just opportunities for you to become a better communicator and understand that as important as we feel these asks are, and they are very important, these people that we're speaking to are tasked with running a budget for the entire country, and every single detail is important, right? So understanding how we can partner and work together and not just be like, well, damn you, how could you say this wasn't important? Because I realized then they knew it was important. We needed to find the right way and language to speak with them to show them how important it was. So the second time we went through, we were successful. So don't be discouraged. Like Anneliese said, sometimes those failures are actually the greatest opportunities.
And because of how our government works, there's a legislative session every single year. So every missed opportunity, the only way that door closes is if you give up, because there is another time to introduce a bill, to advocate for it. And so as long as we have advocates going and talking to people, we will continue to make change, even if it is frustrating that it doesn't happen now.
And I'd like to add something too. You don't have to advocate by yourself. You can bring in your community with you. If you have a doctor who's been there with you, who's been giving treatment and care, and they understand what this bill would do for you, you can ask them if they would like to write a letter or show up on Capitol Hill with you. You can go with your organizations if you have an organization. The more people that you have to go on Capitol Hill, the more strength that you have is strength in numbers. So I believe that bringing your community with you and having them rally around you and showing why this is important, why you need this bill, how this can help not only you, but everyone else up here. I've advocated myself for newborn screening. Now sickle cell is on the registry in all 50 states, but I still advocate for newborn screening because if I had it when I was younger, my parents had it, then they would have saved them time and worry about what I was going through, and they could have had better prepared. They could have set up, had their financial situation better than to just be sprung with a diagnosis that they didn't know anything about. So I believe that you can bring in the community that you serve, and you don't have to advocate by yourself. You can get help. You can go to foundations. EveryLife makes it great. When you have a bill that you want to pass, you can run it across them and have them look at it, because I believe that the more people that you have with you that you can bring into that office, the more chances that you have that they will look at it and take the time and sit with you and understand what's going on. And it's better for you to show up in person too, because you feel that human connection. They see so many bills that come across their desk that they don't know what it is, but when they see a person to match the disease that you're advocating for and you share your story, that story is going to connect, because stories are the driving force of change, and we connect to humans. So it's important that you show up, and it's important that you advocate and you share your story.
I think we have one more question.
Hi. So how would you all go about putting the fire under your RDAC, your state's RDAC, without stepping on any toes?
Did you hear the question?
Kind of.
Could you repeat the question? I'm
So
sorry.
how would you like to give me, for an example, some tips on, so for my state's Rare Disease Advisory Council, they don't have no fire underneath their foot.
I see.
So how do I go in and light that flame without stepping on anyone's toes?
I think, Anneliese, you have experience with a Rare Disease Advisory Council. What would your advice be to kind of energize the members?
I think it depends a little on how your specific states is structured, but there are term limits within that. So I think getting someone lined up to take over when someone's term naturally falls off is one of the most important things, because all you need is one person on that council that really cares and really has that momentum. And if you have that one person, it can kind of create that energy. And by doing it with the natural term kind of limit expirations, you can do that without stepping on somebody's toes. You also can talk to your council as a patient, as a caregiver, as a family member, or whatnot, and tell them your story just like you would any other legislator. And the more they hear from the patients and hear how impactful it is, the more that they're going to feel naturally energized. For the same reason that a governor or a senator is going to care about a bill, they'll care about the issues more.
And generally, this might not be across the board, but the RDACs generally do have public meetings that community members can attend, and if there's a website, usually they post when the meetings are going to happen on their website. So just showing up and showing that the community is watching and care about what the committee is working on can be a great way to help drive too.
I would add, at least in our state, the people on the RDAC are not paid, and these are people who have full-time jobs. They're doctors, they're nurses, they're caregivers, they're patients. And so at various times, as we all know, those other responsibilities might take their priority. So I would look at it less as stepping on your toes and their toes, and more as respectfully providing your support, because they care. That's why they're on the council. They wouldn't choose to be there, but they might not have the time or the resources. So if you say, this is the resource, here's the one pager of what we really need done, or here's the resource that's lacking in their state, that's really helpful to them. And I think having that perspective can also help navigate those interactions.
Yeah, how can I help can really start a great conversation. Great.
Hi, I'm the community program coordinator for an organization, and I personally don't have any connection besides my position to a rare disease. And so my question is more related to what can I do to help advocate? Because sometimes I feel almost like an imposter advocating. I'm also new to the position as well. My background is education, so I'm all for advocating, but it's different than advocating for my students in my classroom, as well as motivating our individuals that we serve to advocate for themselves, because our demographic is also older, and in most cases, mobility is a issue for them, and they're not necessarily tech savvy or want to be on Zoom. So any advice on me and then also motivating other individuals?
It's a great question. I mean, RDLA provides a lot of different tools and resources for patient organizations to advocate as an organization. I'll sell our Community Congress program. It's free for patient organizations to join Community Congress to learn more about how your community is impacted by policy and to lend that voice to the Community Congress as they're prioritizing legislation. So Community Congress is a great outlet for your organization to do that. And then for you as an individual, I am leading an advocacy program for a rare disease organization, and I myself am not impacted by rare diseases. I don't have a personal connection, but I do have a personal connection through the amazing advocates that I work with and through my colleagues who do have rare diseases or a family member with a rare disease. So I think we sometimes don't realize that is a major part of your life, and that through those connections and those relationships, you should feel empowered to be an advocate too. A lot of what Paloma discussed earlier about advocacy, I think that that's when we're talking about like family and friends, right? You know what those individuals are going through, and you know what their daily lives are like. So I think that is that you should feel, give yourself permission to advocate. I think the more the merrier. There's so much work to be done, and the more that we can have joining and being a part of it is just going to help elevate it so much more.
I just want to say everyone has a voice. Like, we use the term advocating. Advocating is just speaking up for what you know and what you've seen someone go through, and using that voice in spaces that can make changes. So don't ever feel like you're not an advocate. You're an advocate because of what you've seen someone go through, and just you have the power to use your voice to speak up. Someone may not have a voice, someone who's nonverbal, and you can speak up and say, oh, this person went through this, or he faced this, or she faced this. And so that's using your voice, and that's advocating. So we can advocate on all different levels, and you are an advocate by having a voice.
I also think the work of people who aren't personally going through it is especially important, because it's really hard as patients and caregivers. You face it every single day. And so if we leave the burden entirely on those people, it's really exhausting. So I would argue that you have a very important role as an advocate in supporting that community. And then as much as we talk about talking in advocacy, advocacy is just as much about listening. And so listen to those people in the organization, hear their stories, and start to understand the issues that really hit home and bring that into the meetings and be that listener and support.
That was great. Okay. I think we have about 2 minutes on the clock.
Yeah.
Yep. Okay. One last question.
Right.
Hey guys, so I am the executive director for the Griffin Foundation. Unlike the previous question asker, I have a great deal of experience in patient advocacy. I was diagnosed with a chronic illness when I was 10 months old. My dad is a rare disease patient. I am a rare disease patient and a 2-time cancer survivor, and my 10-month-old was diagnosed in utero with an ultra-rare disease that affects 0.000102% of live births. So as I'm leading this foundation, my question is, With a patient population of rather a newly diagnosed rare disease, we only have 500 patients diagnosed over the last 15 years. How do I engage this group of parents to really be active as advocates? How do I activate their advocacy efforts? Although they have no experience with the no's and the things that you guys have mentioned, how do I encourage them to be new in advocacy?
I think you have to give everybody a little bit of time to come into what their normal, their routine, what their life is going to look like. There's a lot of shock and burden as a parent when you have those moments. But then also just reminding them that, again, you're not asking to do anything different than you're doing every single day on behalf of that person. Maybe the room looks a little different. Maybe you have to dress a little different sometimes for it. But just encourage them that they are just being authentic in themselves, and they're not really doing, and the act itself is not any different than what they're doing every single day. It's just probably the room or the scenery that changes.
And I think just giving them those opportunities and tools and resources, and you can use anything that RDLA puts out for your own organizations. That's why it's up on our website. So that when they are ready, right, they know where to go, and they know that you have a webinar coming up, or they know that this opportunity with RDLA, Rare Disease Week, or Rare Across America is coming up, and so that they can start to dip their toes in when they're ready.
Thank you so much, panel. This has been such an informative discussion and such an important topic.